Welcome to the Best Damn Podcast. This is your host, Jill Lagan, CEO of the Boulder City Chamber of Commerce. In each episode, we will highlight what makes Boulder City, home of the Hoover Dam, the ideal place to operate your small business, explore world-class tourism attractions, and discover why we are the perfect place to live and unwind. Today we have a special treat. We get to visit with Mr. Larry Barnard, who is president of the Intermountain Health Children's Hospital of Nevada, something I don't think many people know too much about. And I am so excited to have you here today to tell us more about what it is you do and the exciting news that we have from Intermountain Health.
Yeah, thank you for having me. This is really exciting.
Larry, as I have been visiting with you and learning a little bit more about some of the projects that you have coming online, can you share with me the very first thing is how long has Intermountain been in the state of Nevada? And how come I don't know more about it?
Yeah, we are one of those, we're very humble, I think, is the reason. We've been here about 7 years, one of the largest physician groups in the state of Nevada, and really work on the outpatient side, lowering cost of care. So working with Medicare Advantage, so people eligible for Medicare, and finding ways to keep them out of the hospital. And so we've been doing that for about 7 years. And it's just been it's been great to be a part of this community. And most people think, oh, you came when you named the Raider Stadium or the practice field. But in reality, we've been here for a while.
And so obviously, because your name's big on the side of a building, that means you're successful, right?
I think it's twofold. The reason that Intermountain wanted to do that was to really show a connection to the community and really be a part of the fabric of Las Vegas. And with the Raiders coming in, it really was an opportunity to partner with someone as big as the Raiders and the NFL to really just kick off us coming in even more. So on top of the clinics, the other things that we're looking at doing.
So this isn't just something that the football players get the opportunity to be a part of. This is in our community. We have a center right here in Boulder City. It has become instrumental in providing healthcare for many of our seniors because if I'm understanding correctly, you really have an emphasis in that senior care. Is that correct?
Very much. And we are starting to expand into the pediatric realm here. But the idea that's different about Intermountain is it's how do we keep people healthy? Most hospitals are like, we need as much volume as possible. We need as many surgeries as possible. And that's the way that we financially keep hospitals working. Intermountain really is taking a look at how do we keep people healthy and let that be the generator of finances. How do we keep people out of beds? How do we keep them at home? And that is a new way of proactive care that we're looking at that hopefully will change the way people get healthcare.
I love it. And also look at it a little bit differently, the fact that you are willing to not just chase the dollars, but chase people's quality of life.
Oh, definitely. Intermountain's very unique in that sense that it is really about the mission more than it is just about how much we can make. And a big thing is that all the dollars that are made are reinvested in the community. They don't go back to mothership where it's back into the community. So it's an opportunity to not only invest in the facility and all the outpatient services, but actually back into the community itself.
I love that. And so I would imagine morale amongst your employees is also higher because of that.
Oh, definitely. I do orientations all the time with the new staff and having discussions about why they joined. A lot of it has to do with the mission, honestly. And this is not just Intermountain. All healthcare workers are really, I don't want to say giving up something of themselves, but they're really focused on something bigger. You can make more money doing something else in a different industry and not deal with the heartaches of human life. People pass away, people are at their lowest, and these people, nurses, techs, doctors say, I want to be a part of that human journey. So it's just so impressive. And then on top of it, you look at an Intermountain that says, look, we're going to try to we're going to let you do what you do best and don't worry about all the other, we'll worry about the business part. You worry about the clinical part.
And I would imagine that drives more interest into your particular corporation versus others. I can see that there's probably a different level or a caliber of individual that wants to work for you as well.
Yeah, definitely. And there are a lot of people that do want to come. And I always thank the people that choose to be with us at the orientation because we're interviewing them, but they're interviewing us and we just want the best. And that's what that mentality is going into this pediatric project of how do we get the best that already exist here and then finding the best that doesn't exist here so that we really have a product that really takes care of the kids of this community.
Very excited to talk a little bit more about the big picture here. I have no idea why this has never been addressed before, but can you please tell us why Intermountain Health is building the first standalone children's hospital in the entire state of Nevada? What the heck?
It's interesting. Originally, I left St. Rose and went to LA. And I was working at a trauma level 1 hospital in Linwood. So right next to Compton, right next to Inglewood.
Yeah.
And I loved it. It was very mission based. It was about taking care of a community that just lost its voice over time. And I really loved it. And we put just putting in a little bit of effort to get into the community. People just were so excited. And so was in a great spot. First time in my career that I didn't want another job, didn't want to move up in the next level. And I was contacted by Intermountain saying, hey, there's an opportunity. We might be building a children's hospital. Would you like to come? First interview that I came into where I was like, I can say whatever I want. I can just be me. If I don't get the job, I don't get the job. And I met the leaders that were part of this program. And one in particular, Katie Welke, she was the president of Children's Health. She really walk the walk. This was not, when it came to kids, it was truly about kids. It wasn't anything else.
Oh, neat.
And I saw so many examples, even in that interview, where she's dedicated her life to the health of children. And in that moment, I really was like, I need to be a part of this project now. I really want to do this. Because reality is, if you're coming to Nevada, you're not going to make money off of children. There's no money in pediatrics.
I did not know that.
Yeah, it's mostly Medicaid, the kids that are here in the city or in the state. And so that's not where the most finances can be made. If you want to make money, it's like open heart program, and that's why you see so many in town is that if it makes money, there's 3 or 4 of them. If it doesn't make money, it really doesn't exist.
Good point.
And so when it comes to pediatrics, Intermountain said, where can we make the biggest difference in the healthcare community? And it was in peds. And as a business decision, it was probably at the bottom 25% of things that you should do. But as a doing the right thing, really trying to raise the level of healthcare, it was right at the top.
So it meets your mission.
It meets the mission. It really made a difference. This is how Intermountain thinks. We have the only pediatric neurosurgeon in the state of Nevada in Las Vegas working at Sunrise. That position loses money every year. It just loses money because it's just based on the outpatient work that physician's doing and other factors. But years before the hospital's open, Intermountain said we need to send someone down there. We're getting too many kids coming up to primary children's in Salt Lake that could just be taken care of in Vegas. And so they sent out Dr. Bragg, and she's been on her own for a while. We're looking to expand her program, but at a loss. And also to keep the kids from coming to Salt Lake. So that's against the normal business mind of let's get as much as we can to really, this is hard for the kids. Let's just keep them in Vegas. And that mentality has driven this project from the very beginning.
I think I want to meet her. So I can imagine for families that are there, it's already scary that they're having to go to Salt Lake in the first place, but now they're worrying about their families and their kids that are still here, and it's going to cost them money to stay there. And it's just what a blessing to be able to have that happen here.
Oh, there's so many stories of families that they're 2-income families. Someone has to quit their job to take care of their child, or they're going up every week. It's so disruptive, and in some cases so financially burdensome that some people can't recover. I met someone that I've gotten close with telling me his story. His son had to travel to LA every other week, and they were going on a routine trip, and almost to Baker, I think it was around Baker, his son passed away.
Oh my gosh.
And so the family wasn't there to say goodbye. This wasn't in his bed. This was on the side of the road. And he made a comment to me that there are so many kids being taken by the 15 that we just don't realize.
Oh my gosh. That is such a statement.
Oh, and he is, what's crazy is his strength to tell that story so other kids don't have to go through it.
Right.
And he's been an advocate for this project since the beginning. And it's people like that we're doing this for. There was an argument in the beginning, how many kids are really leaving? And do we need this children's hospital right now? And it really comes down to the one. If you're looking at a number,
Yeah.
it's very easy to go, okay, if we don't have it, we'll be all right. But if it's your kid, that whole story changes. And I think in the end, people are going to recognize how important this is and how we should have had this 40 years ago.
Absolutely.
We're one of two cities, major metropolitan cities, that don't have a standalone children's hospital. And so this is really going to not only elevate the care that's already here, because we have some really great physicians and service lines and staff, but it's also going to bring them together. This is almost like an anchor point to say, okay, children's care should happen in one place. It shouldn't be at different hospitals and you have to go to 5 different doctors that don't see each other. Let's come to one place and treat the child as a whole, not just as different symptoms.
My youngest daughter needed to see a pediatric endocrinologist, and she was just 7.
Yeah.
Unfortunately, there was only one in the entire valley at that point in time, and so trying to get in was very difficult. And I can imagine that that's just a very small sliver of the concern, but this story just amplifies such a great need, and it shocks me that we haven't had something sooner. I do remember as a kid growing up, the Children's Miracle Network that happened over at UMC, and it seemed like that was really the biggest advocate that I can remember for a children's program. And I'm sure you obviously you have a little bit of history at UMC. You'll know a little bit about that, but it does shock me other than to know that maybe you got to follow the numbers, follow the money. And unfortunately, in this particular situation, like you said, until Intermountain came along with the idea that we're going to stick to the mission and we're going to help the one. And if the numbers don't always calculate, how do you make up that difference? So is it up to us to be a part of helping?
Some things have changed over the years in terms of reimbursement. Medicaid, unfortunately, Nevada is one of the lowest payers in the US. So we have one of the lowest payers. So you see that kind of, if you're not getting reimbursed at a certain level, it's very hard to keep your doors open. And so some things have changed in a positive way, still not enough to get us out of the bottom, but enough to say, okay, let's make a go of this. And so you've got Intermountain, and this is not just an Intermountain thing. A lot of people are like, oh, it's just Intermountain's coming and that's the difference. There's a lot of factors. Intermountain's a big part of it, but then you have to look at the community and say, all right, if we're going to put up X amount to build this, how much is the community going to put in to say that we have skin in the game? This is not a Utah solution. Intermountain's from Utah. The last thing we want to do is come in here and say, we know what we're doing. Let us do this. And the reality, this is a Nevada solution. And so it comes down to politicians, philanthropic support, community support, all of that to make this work. And so not just one of those can make it happen. And that's why this project's been going on for 40 years.
Yeah.
Everyone's been for 40. I got here 15 years ago, and I think it was the third iteration of trying to get this done where there was just not enough of all of them. Money, politics, community support. Everyone had a little bit of each, but not the full support of all of them. And I think we finally gotten to that point where we've moved through some of the barriers and we're going to see this thing happen.
I love that. I'm so excited that you're at the helm to lead this process because it sounds like you're the right person. Can I go back to something that you said? I've got a question. So why is Nevada the lowest payee of Medicaid? Why reimbursement of that? Why is that the case? And how do we change that? What's the answer?
So the reality is that one of the most difficult jobs, I think, is the politicians in the state because they're given X amount of dollars and there's so many needs out there. How do you distribute it to each one? And so because of that, they need to figure it out. Now, I'll tell you, as an individual, I love the fact there are no state taxes. It's such a great thing for me. But as a state, it makes things a little bit more difficult when you're pooling the dollars from a specific source and that's all you have.
Got it.
So it's the balance between those two things. And it's what makes Nevada attractive is that kind of support to the individuals. But at the same time, we're going to have to make some really thoughtful choices on where those dollars go. So it's not an idea of someone's doing something wrong or it really comes down to just like your own personal budget. If you have $1,000 a month, where does that all go? And there are certain infrastructure things that have to be paid. And then you have other areas to support, and you just have to make some really hard decisions. So I think that the state of Nevada is really working hard and understanding where to do that. But again, there's so many competing things that it's a hard role.
So, what I'm hearing you say is that for me to have the quality of life and enjoy the low taxes, I then need to step it up. And when a need is put in front of me and presented to me, such as funding this hospital and making sure that it's successful, I need to step up. I need to make sure that I'm giving when I can, trying to find other means that I can help support your efforts.
Yeah. And really, it's not obviously the dollar is important, but I think giving what you can. If it's $10, it's $10. And I don't want to just say that's for the hospitals, for anything in life at this
True.
point, really. Like,
Point.
just if there are things that you are passionate about and love, I think historically, it's very easy for us to say, I will do this when, or once I get over this, I'll be happy. And really looking in the present and saying, all right, I have $10 today. I'm going to give it to the children's hospital or whatever you're looking at. But one of the most important pieces is not just the money, but getting the word out and talking to people and saying, hey, this is important. And I've talked to people that don't have kids, like they're like, my kids are now older. And they're like, this kind of doesn't affect me anymore. And it definitely does. It affects the rate of our healthcare and education, determine what companies want to come move here.
Right.
If kids are sick and are not able to attend school, it affects their future, which then goes into what jobs are they going to do? Where are they going to spend their time? Like, it's so much more than just is the child, but it's the community that gets affected by the fact that we have this or not. Just think about if you're a business owner and you've got employees that can't come to work because they have to travel to Salt Lake City to take care of their kid. That's a lot different than, hey, I have an appointment today versus, hey, I got to take next week off because I got to drive 8 hours away and I got to do that monthly.
So, you have a heart condition, you're going to your cardiologist, but that cardiologist has a child that's sick. That cardiologist now has to leave and go take
Yeah.
that child. So now your healthcare, your daily activities are impacted because of this. This is a domino effect that
Great example.
we're
Yeah.
not really thinking about the fuller picture here. And my gosh, you guys are going to be amazing. I'm super excited. So tell me a little bit more about some of the specialties that'll happen within the hospital itself.
So right now we're looking at everything except for full organ transplant.
Oh,
So it'll be a full service standalone academic tertiary hospital. So the only thing that we won't do is like a heart transplant or a lung transplant. Everything else we're planning on trying to deliver.
and is it an educational school? So will students be coming from the University of Utah, and will we see some of that?
Definitely. We want to partner with the state schools and any of the not-for-profit schools that are located here in Nevada. But yeah, academics, research, we want to do residencies, fellowships, and specifically because it's been talked about for years in the state, but where people train is usually where they stay. And so that's why the medical school was so important, because if you're training here in Nevada, you're going to stay in Nevada.
Yes.
And so with the children's hospital, if we can get pediatric subspecialties to train, then they're more likely to stay here and be part of the community.
And part of the solution.
Exactly.
And it also sounds like between meeting your mission and creating a great morale with your staff, you've got the full package here. It's pretty exciting, really.
It's really amazing to see this is the vision of a lot of people, right? This is the vision of Intermountain and their senior leadership, the regional leadership team, the community. We actually have an event coming up. I don't want to say event. We have a meeting coming up where we've reached out to certain groups like Act for Kids to talk about, can you bring families that have gone through the system so they can look at the hospital design and give us ideas on what worked and what didn't work. This is not this is not a Utah solution. This is a Nevada solution. And we want to bring those people. And we have physicians that are coming in. We have pediatric neurologists. We have orthopedics. We have oncology that are in the community looking at the design saying, if I'm starting this from scratch, I would love for this and this to happen.
Wow.
And so we're incorporating that into the design so that the doctors from day one can say, okay, I'm a part of this.
That's amazing. Yeah, I find that fascinating. That's a great way to look at that opportunity and for them to also have buy-in to this process.
Oh, 100%.
Yeah,
This is
that's great.
only going to work if the community embraces it and sees us as a partner here versus somebody's coming from another state thinking they know the answers. Like that never works in Nevada. So it truly has to be all of us.
I love it. And obviously, those focus groups are taking some time, but what is your timeline? When does this look like it'll be completed?
So we're looking at 2030
Oh, wow.
is when this will be done. And that's one of those where it's, wow, that's far out. And then
Sounds so scary.
at the same time, I'm like, that's like tomorrow. So we're changing the oil in the car as we're driving down the highway. It's one of those where every single aspect is being worked on parallel right now.
And where will it be located?
It's off of Sunset and Durango at the UNLV Tech Park. So
very good.
near Kia. So it's on 34 acres there. It's going to be a beautiful campus and be very open to everyone within the state.
I love it. And so our little local office will be able to also keep us informed of what's going on down there. And I plan on keeping my ears open as anytime you need any help or any assistance. I can't wait to help spread that
I
word.
appreciate that.
That is great. Okay, so I can't let you leave before I ask you some very fun questions.
Oh,
too,
these
right?
weren't the fun questions?
No, yeah, those were our informative questions.
Okay.
And now we get to know a little bit about the person behind the CEO title or the
Okay.
president title. We love to know a little bit more about you because I think it's important for us to know the people that are leading us. And as a community leader, we want to make sure that we know who you are.
Okay.
Tell us a little bit about where you came from.
So I was an Army brat and then went in the Army. So Vegas is the longest I've lived in one place. So that's home. That's 15 years.
Great.
I went to West Point just to follow in my father's footsteps type of thing. He was
That's
in the
awesome.
Army. And then became a helicopter pilot. And then from helicopter pilot, I made my way into healthcare, which is what ended up happening is I tried to come to Vegas after the military and everyone's, are you good with a gun? And I had multi-million-dollar assets. I had hundreds of staff and they're like, you should be in security. And I was like, I kind of want to do management in a different way. So I went back to get my MBA at USC. And there's a 50% scholarship. If you were in the military, there's a person I'll pay for half of your tuition.
Wow, that's cool.
No questions asked, nothing. So I was like, okay, I need to meet this guy. And it turned out he was a healthcare executive. He was a retired general in the Marines, but became a healthcare executive and ran an old company called HMA. It doesn't exist anymore. And he told me healthcare is the closest thing to military service.
Really?
Yeah. And he was like, this is how you give back to your community. And I realized over time looking back that I've really been about service. So it was a great fit. And honestly, at the time I could run an AT&T call center. I could work at Otis Elevator, working on people movers is what they call them. Or I could go be a leader in a hospital. And so I went with the hospital. And I enjoy it.
That is so great. And so I know you've had interactions with UMC, any other hospitals?
We've reached out to all the hospitals. This really is about a collaborative effort. We really want, the intent is not to stifle any of the other things that are happening in this state. It really is about how do we work together? How do we get the highest level of care possible so kids don't leave? And so we've worked with a lot of them and talked about ways that we can collaborate.
I can imagine because your history, being a convener and a collaborator, it fits right into exactly what your background is all about. So they picked the right person for this position.
you.
I'm really glad that philanthropist was willing to help fund that effort and then help educate you on the importance of military service being so much medical service. I would never have thought that, but that's an interesting concept.
Oh, it definitely is. When you go onto a unit of a floor, you have all of those team members working together for the same reason, just to help someone's family out, to help a person out.
Right.
That kind of lends into the same concept of the military, of a group of soldiers or sailors or Marines or any of those working together to just get the mission done.
Right.
So it's very similar, but it's hard to think about on your own with it.
I love that. Thank you. You've opened my mind to that thought process. And here's my favorite question to ask all of my guests. What book are you reading right now?
So it's interesting. Have you ever heard of Libby? It's an app.
No.
Oh, this is probably the most important hint or life hack for everybody on this podcast.
Take note, everybody.
Yeah. It's called Libby. It's an app that you can download and it is directly connected to your library. So if you go to the library and get your library card, you put it into Libby and now you can download any audiobook or regular book for free.
Wow.
If you're spending $20 trying to get an audiobook, you get it there for free. And so what I do is I have Libby, and I'm a weirdo. As I drive, I like to listen to books on tape, but I've learned that if you go from 1.0 speed, so regular speed, to 1.5, and you do that for a couple books, then you go to 2, and you do that for a couple books, ultimately when you can get to 3 times, you're finishing books at record speed. My girlfriend, Gabby, always makes fun of me because when she gets in the car, it's like, I understand it. She thinks it's just gibberish, but so I use that. And so I'm reading a couple of books right now, The 5 Types of Wealth, which kind of talks about, it's not just financial wealth, but it's health and spirituality and
I
things
saw
like
that featured, but I didn't in Audible, but I haven't looked at it yet.
You could have gotten it for free. You don't have to spend the $20.
Yeah.
And then the other book is I think it's called Everyone Communicates, Few Connect. And so it's really about everyone's talking, but are you actually listening? Are you connecting with the person? And here are ways that you can connect more with other people. So
that's pretty fascinating.
Yeah.
Because that's right along the line of a podcast.
Exactly.
I might need to check that one out too. So we have a business book club that is actually a part of one of the Rotaries here locally. And I just find it fascinating, the books that people read. It tells you so much. And when you see a very influential leader or somebody that you're thinking must just sit back and read the Wall Street Journal every minute of every day, and then they're telling you that they're reading Fabio books, and you're just like, what? It's a trip. I find this fascinating to a little insight. Or individuals that I'm assuming they're going to talk about a powerful leadership book and they say, oh, the Bible. And I'm like, you know what? I need to take a step back and realize I should be doing the exact same thing. So anyway, I just find that a fascinating question.
It's a good question.
And then this one's a special question.
Okay.
What is something your mom and dad taught you that you still use today?
Oh, wow. That's a good one.
That one is a good one. Maybe a phrase or something you guys always talked about.
I know exactly what it is, and it comes up a lot, especially in our family. My dad used to say this all the time. Do you want to be right or successful? And it was really good for me to understand, because as a younger kid, I'm like, I'm going to argue this until you understand that you're wrong and I'm right. And now as I'm older, I want a lot of peace in my life.
Yes.
And sometimes with peace, it's not about arguing. It's not about getting your word out. It's not about being right. And so, yeah, that's something my dad's always said. You want to be right or successful. They're not always connected.
I wish he would teach that to social media. He would be a fascinating teacher. That is amazing. I am very excited and grateful for your parents for teaching you such great things and creating such a great leader, because I have really been educated. I had no idea this was all happening, and very happy to be a part and want to make sure that we can do whatever we can out here in Boulder City to make sure that your efforts are a success. So thanks for sharing. Thanks, Larry, for being here. And we really appreciate you.
No, this is amazing. This is the Best Damn podcast. So
thank you.
I appreciate you guys letting me come on and talk a little bit, and it's been a pleasure.
Thank you. Have a super day.
Thank you too.
This episode of the Best Damn Podcast has been a production of the Boulder City Chamber of Commerce. Please check out all the links and social media handles on our website as well at bouldercitychamber.com. You can find the Best Damn Podcast on all your favorite podcast directories. Like us and share on Facebook, Instagram, and Twitter. Until next time, discover, explore, and unwind in Boulder City.